All right, we start chapter 5 on prenatal laboratory testing. We're going to look at what are the tests that we do the first trimester, well actually more accurately on the first visit, which is usually in the first trimester, then the second trimester, and then the third trimester. Let's look at first trimester laboratory tests first. Here we have our case. A 21-year-old gravid O1 para-0 presents for her first prenatal visit at 11 weeks gestation. Is confirmed by obstetrical ultrasound. How accurate is that? Remember, plus or minus 5 days if you do a first trimester ultrasound. So we can confirm she is in fact 11 weeks. She has no risk factors. What laboratory tests should be ordered? What are our routine laboratory tests? What I would like to do is to separate these, instead of just remembering a big long list, let's separate them into 3 groups. We'll look at those for maternal benefit, those for fetal benefit, and those which are immunization. As we look at the first one, which is a CBC, what is the purpose of a CBC? Purpose of a CBC is to assess for maternal anemia. What is the impact of anemia of the mother on the fetus? The most common maternal anemia is iron deficiency anemia. If mother is anemic, is the fetus anemic? No, because there is active transport of iron across the placenta. This is not for the fetal benefit, this is for the maternal benefit. The mother can have a hemoglobin of 8, of 9, and yet the fetus will be fine because of the active transport across the placenta. Cervical culture is actually probably more like DNA probes for gonorrhea and chlamydia, and this is going to be for both maternal and fetal benefit, because if the mother is infected, the fetus can get infected, and we want to make sure that that's not going to happen. A urine screen, we'll talk about that in a little bit more detail. What are we looking for here? The main thing that we're looking for on a urine screen on a routine patient is asymptomatic bacteria. Bacteria in the urine. What is the prevalence of that? About 8% of pregnant women. What is the impact of a urinary tract infection of the mother on the fetus? Nothing, directly. This is primarily for the maternal benefit. Now, if the mother develops pyelonephritis, preterm labor is more common. A pap smear. The purpose for a pap smear is to identify precancerous changes of the cervix, cervical dysplasia. What is the impact of cervical dysplasia on the fetus? None. This is primarily for the maternal benefit. So CBC, urine screening for an infection, pap smear is primarily for the maternal benefit. Let's look at this tests which are done for fetal benefit. We're going to do a type in RH along with an atypical antibody test. What is the purpose of the atypical antibody test? Is to identify any red blood cell antigens against foreign red blood cells which are in the mother's bloodstream. What is the impact of these foreign red blood cell antigens, or I should say antibodies, on the mother? Nothing, as we'll talk about in the next few sections, that if the mother has antibodies, she is typically antigen negative and they have no impact on her. So who is at risk? It's a fetus. And if those IgG antibodies cross the placenta to the fetus and start hemolyzing the fetal red cells, then the fetus becomes anemic. So the main purpose of this is for the fetus, not for the mother. We already talked about the gonococcus and chlamydia screening. That is for both mother and the fetus. VDRL. VDRL is a screening test for syphilis. This is for syphilis. What stage of syphilis is it typically picked up in a pregnant woman? Primary, secondary, latent, or tertiary? How many of you have seen chancres in pregnant women? My suspicion is very few. How many have seen condyloma lata? Very few. Most women who are pregnant who have syphilis, it is going to be latent syphilis. What are the symptoms of latent syphilis? Nothing. If the syphilis starts to invade and affect her central nervous system, then we call that tertiary. Only about a third of patients who develop syphilis will develop that. So most women are going to be latent syphilis. No impact on her body at all. Who is then at risk? The fetus. And with all stages of syphilis, the likelihood of fetal infection is about 60%. So checking for syphilis is primarily for fetal benefit. Next one is HIV. HIV testing. In most women who are diagnosed with HIV, what is their viral load? Very low. What is their CD4 count? Normal. What is the impact on the mother? She may not even be treated with any antivirals if she was not pregnant. But who is primarily at risk? The fetus. And if she is not on antiviral agents, the risk of fetal infection is up to 30%. The purpose then of HIV screening is largely for the fetus. Gestational diabetes mellitus, GDM. What is the purpose of this? We want to see if the mother has elevated glucose values in response to a glucose challenge. What are the symptoms of gestational diabetes on the mother? None. It's a chemical diagnosis. What is the impact of gestational diabetes on the mother during the pregnancy? None. Now, 10, 20 years later, she may very well develop type 2 diabetes. The primary impact of gestational diabetes is on the fetus. Gestational diabetes is largely for fetal benefit. The third group of prenatal laboratory tests that we're going to do on the initial visit, typically in the first trimester, are those for immunization. Now, we may not immunize the patient during the pregnancy, but we're going to find out who needs to be immunized. The rubella IgG antibody titer is looking to see if she has protection against rubella. And most women do. But if she is susceptible, we want to mark that on the records, and after delivery, she will receive the immunization. She doesn't get it during the pregnancy because it is a live, although attenuated virus. We're going to screen for hepatitis B surface antigen. If she is hepatitis B surface antigen positive, the most likely thing is that she is a carrier asymptomatic. Of course, we're going to check her liver enzymes. We want to see if her bilirubin is elevated. If she has normal liver function and only hepatitis B surface antigen, we don't do anything for the mother. But what we will do is to immunize the baby after delivery. We're going to give hepatitis B immune globulin, and we're going to give the first of 3 injections for active immunization. We're going to check the mother's type and RH, and the main reason for this is if she is RH negative, we will immunize her at 28 weeks with RH immune globulin, and after delivery if the fetus is found to be RH positive. So we've got those for maternal benefit, fetal benefit, and immunization. I'd like to just look briefly at, is this primary, secondary, or tertiary prevention? Now remember, primary prevention is where you prevent the problem from ever developing. Secondary prevention is where you have early detection and prompt treatment. Tertiary prevention is where you've got a problem which is already severe, and what you're doing is to prevent it from getting worse. When we look at these tests, all of these under the column maternal benefit and all of these under the column fetal benefit are secondary prevention. It is early detection and prompt treatment. Those which are under immunization are all primary prevention. We want to prevent rubella from ever developing in the mother. We want to prevent hepatitis B from developing in the newborn. And we want to prevent isoimmunization in the mom. The last thing I want to point out to you is notice how many of these are sexually transmitted diseases. A great deal of our prenatal screening is looking at sexually transmitted diseases and preventing the fetus and newborn from becoming infected. In terms of urine screening, we're going to screen for renal disease, by doing a urinalysis. What will you see on the urinalysis if she has renal disease? You're going to see red blood cells, you may see proteinuria, or you may see casts. If you have a normal urinalysis, no red cells, no white cells, no casts, no protein, you can feel pretty comfortable that she's normal. The biggie, of course, is asymptomatic bacteria. And 8% of pregnant women have asymptomatic bacteria, and a urine culture will pick that up. Tuberculosis screening is not routine. If it is done because of high-risk population, we will use a tine test, a skin test that is appropriate during pregnancy. If you have a positive skin test, what's the next thing you're going to do? We're going to get a chest x-ray. Now, this is going to be a shielded chest x-ray. Is that okay in pregnancy? Yes, it is. If you have a positive skin test and the chest x-ray is negative, then what do? You give INH and B6 for 9 months. Is that okay in pregnancy? Yes. What if the skin test is positive, the chest x-ray is positive? Then what are you going to do? We're going to do sputum cultures, looking for acid-fast bacteria, and if that is positive, we're going to give the triple treatment. Okay in pregnancy? Yes. Appropriate. HIV screening. The recommendations are that all women who are pregnant are screened for HIV. Now, we need to get a consent. Now, it used to be that what we would say is sign this paper if you would like to be tested. The Center for Disease Control is recommending, instead of an informed consent, that we obtain an informed refusal. And the difference here is you say to the patient, these are the laboratory tests that we normally get during the first visit. If you don't want any of these, we'd like you to sign. In other words, an informed refusal. And the idea here is if we go with informed refusal rather than informed consent, we'll probably get more patients who will be tested, and that's going to be helpful for preventing HIV in the newborn. In HIV testing, the screening test that we get is the ELISA test. If that is positive, then you do a Western blot test. And the likelihood of a false positive is about 1 in 10,000. I had a patient who was pregnant, had had sex with 2 men, a boyfriend and her husband. She was infected, it looked like, from her boyfriend. She had a positive Western blot test, and she said, "Doctor, could it be a false positive? Could it be a false positive?" 1 in 10,000? Unlikely. And yet she had no idea. All pregnant women should be screened for HIV. All right, the last prenatal test that we're going to get in the first trimester is Pap smear screening for cervical cancer, and we talk tomorrow about that in the section on cervical cancer. All right, just in summary then, the prenatal laboratory testing, there are those tests which are done for maternal benefit, there are those tests which are done for fetal benefit, and immunization. And if you can remember them in this visual format, I think it'll probably be better in bringing it back to your brain when you write the USMLE2. And you are going to pass. All right, that's the end of the first trimester laboratory tests.